20% of the United States population gets infected with the flu every single year. Yes, it is that infective and even deadly, for high-risk individuals. To avoid getting infected from it, the best way is to get flu shots, new one every single year because the virus will keep on changing. Shocking, right? How do we get the flu and how do the flu shots work? All will be covered in this video. Let's learn. What is flu? It is a common and highly infectious respiratory disease caused by influenza virus, which can make you feel miserable. This will affect the respiratory tract starting from nose to lungs. There are 4 types of this virus: A, B, C and D. Type D will not affect humans, whereas A, B and C can. Incubation period is the time taken to show the symptoms after infection from the virus. In case of influenza, it is 1 to 4 days. You can get flu if you inhaled the air in which the flu patient coughed, sneezed or talked, within 2 to 8 hours or after touching the surface that flu patient touched before and then touching either nose, mouth or eyes. When patient sneezes, load of virus will come out of his respiratory tract. Flu season starts from the end of October to March, winter, with the peak in February. The reason for that is people spend more time indoors in close contact with each other. But you can get infected anytime. Important: flu and common cold are different diseases, even if they share some common symptoms: runny nose, body ache, sneezing. Flu symptoms: fever, sore throat, vomiting and diarrhea in young children, cough, muscle pain, headache, fatigue. How long does the flu last? Once a person will get infected with it, he will start showing symptoms after around 2 days. After that, the disease will last for around a week and will get cured on its own. But, if the person has taken a vaccine, he will not get an infection most of the time. Even if he does, in minority of cases, from different strains of virus, he will recover quickly because different strains share few common elements called cross-protection. Important: even if the person is not showing symptoms in 1 to 4 days after getting infected, he can spread disease. Prevention: as the flu spreads by touching the surface on which the patient sneezes or coughs, and then touching nose, mouth or eyes, avoid touching your face frequently. Even if you need to do so, wash your hands first with mild soap and tap water or alcohol-based sanitizer first. Boost your immunity to get protected from not only flu, but from most communicable diseases. The best way is to take flu shots, explained later in the video. If you are going to any area where flu is prevalent, you can wear a mask while in public and take flu shots as an extra line of defense, even if you are healthy. If you have flu, avoid going in the public, school, workplace or mall. If you have to, keep distance from people, and when you sneeze or cough, do it in tissue and dispose it of. In case you do not have tissue, do it in your arm. Recovery: people will generally recover from the flu after 5 to 7 days, but few people will get bronchitis, sinusitis or ear infection. Also, those with heart disease or asthma might get sicker. Treatment: as mentioned, most of the flu patients do not require treatment, and those who do could get cured by home remedies. Honey: it is an effective cough suppressant that could be added in tea or coffee. Also, it will help relieve the pain of sore throat. Humidifier: this will give you relief from congested nose. Stay hydrated: due to flu, your nose will be draining continuously. This can dehydrate you, so keep sipping water, preferably lukewarm water. Lukewarm soup: it will ease the symptoms of sore throat, provide hydration and electrolytes. Ginger: it will help in suppressing the nausea and will suppress the cough. So, a slice of it should be added in tea or any liquid that the patient has to consume. Ginger, lemon and honey will aid in recovery. Only handful of people do not get cured even by home remedies. They need to see doctor and take medications for their flu. These medicines are antiviral medications. It will work by stopping the replication cycle of the virus in the body. If it is taken in the first 48 hours after getting infection, it will benefit immensely. However, if taken later, will also aid in recovery. Nasal decongestant, relief from stuffy nose will be provided by it through breaking the mucus from the sinus. Analgesics: flu infection comes with a lot of pain in the body, muscle ache, body ache and headache. Analgesics like acetaminophen, ibuprofen will relieve these painful symptoms. Antibiotics. Even if flu is a viral infection, antibiotics are advised to prevent superinfection, another infection over the existing disease. Antibiotics will prevent the bacterial infection of ear, sinus and throat. Even after all those treatment guidelines, 0.1% according to CDC will die every year due to flu. They mostly have existing health conditions, another disease that will make the patient sicker. Flu shots. Process of manufacturing. Fluid containing influenza virus is taken out from eggs and the virus is killed chemically. This will reduce the toxicity of the virus, so it cannot initiate the disease in the person it is injected to. Who should take it? According to Centers for Disease Control and Prevention, CDC, people above the age of 6 months should take it annually. Particularly those who are at high risk, virus could be life-threatening for them. People over 65 years, obese people, BMR above 40, young people below 5 years, pregnant women, patients suffering from chronic medical conditions that lowered their immunity. As the viral structure will keep on mutating, a person needs to take a new vaccine every year made according to the new anticipated strains of virus. Flu shots are available in injection as well as nasal spray, but people who are immunocompromised, asthmatic, pregnant or having existing respiratory illness are not perfect fit for the nasally sprayed vaccine. CDC recommends that a person has to take a vaccine shot by the start of October, as the vaccine will take 2 weeks to act. That's the same time body needs to produce antibodies against the flu viruses. Are flu shots safe? Yes. Flu shots are 100% safe. You do not get disease after taking it. The whole purpose of flu shot is to evoke an immune response. As it is mentioned that the virus in it is killed, it can only make the immune system react to it, but not make you sick. Serious, majority of flu shots contain egg protein. So, if you have mild egg allergy, you do not need to worry, you will be able to withstand it. However, if you have serious egg allergy, consider taking flu shots only under medical supervision. Temporary side effects of flu shot. Even if the flu shot will not harm you in the long term, you can experience a few issues after taking it. Like soreness at the site of injection, mild fever. If the symptoms are severe, you must contact your doctor. Conclusion. Flu is a super contagious disease, which is very common especially in winter. To prevent it, wear a mask in the public in flu season and avoid touching your face before washing hands. You can prevent the flu by taking flu shots that are 100% safe. It is newly made every year as the viral strain is constantly changing. In this video, we covered everything about flu and flu shots. Even after watching this, you have any question or want to know more, feel free to leave a comment below. For more informative videos like this one, subscribe to my channel and turn on notifications.